Thank you so much, Dr. Montes, for joining Be Latina News. My name is Giselle Gomez. I'm the Senior Deputy Editor at Be Latina. And we are here because we're going to talk about something very important that affects not only our community, but those communities who have been historically excluded. Today, we're going to be talking about reproductive health and more so on unintended pregnancies. As many of you already know, unintended pregnancies affect usually women of color between the ages of 18 through 24. And there's many factors to it, but one of those factors is the low economic background. And see the after we touch on that, there's the other layer, which is that women already by default have limited access to information, tools, and resources, which don't give them the opportunity to get to contraception, and it does not allow women to be in control of their reproductive health. So today, everyone, we're going to be talking to Dr. Erica Montes. She is a board certified OBGYN, and she is also the founder of Mother Mujer. And she's going to give us tips on how to maneuver and go about these conversations. Hello, Dr. Erica Montes.
Hi, Giselle. Thanks so much for the opportunity.
First and foremost, can you please dive into how unplanned pregnancies can affect women?
Yeah, that's a great question to start with. So, I do see this more often than I would like, and it definitely can have some health consequences, including your physical and mental health. And unfortunately, it can also lower the potential that women can achieve in their educational goals and also in their employment. But what I have seen over the last several decades is that women, especially Latinas, are really trying to take control of their futures. They want to plan for their families. And so right now, it's important for women to know that there's a lot of different birth control options out there that are available. And I want to be able to help you make a good decision on which one to choose from, and also how to have that important conversation with your physician.
Of course, and that is very important, Dr. Montes, and thank you so much for that. And now, we have been in the pandemic now for 3 years, and we've seen it all over the place that it's affected so many things. And I'm only assuming that the pandemic has also affected family planning. Can you elaborate more on this?
Yeah, over the last 2 years, I've seen patients in general just kind of change their routine, change where they work, how they kind of go about their daily lives, and definitely their family planning goals. In fact, a survey showed that more than 40% of women of reproductive age are considering prolonging when they'll have their first child, and even how many children they'd like to have because of the pandemic. And this definitely includes Latinas. They are coming to me and telling me that, we really are nervous about this pandemic. We're anxious. We find that at this point, it's important for us to be able to plan for the future. And so birth control and knowing the options are more important now than ever.
No, absolutely. And, you know, as a Latina and as someone whose family has always, not spoken about contraception because it's embedded in our culture just not to touch that topic, right? So I think
Exactly.
it's a little intimidating for a lot of us to have that conversation. And many of us don't even know how to start it with our own doctors. So, how would you approach contraceptive counseling? How would that look like ideally?
Yeah, I actually have 3 boys myself, so I've had this conversation with my physician. And growing up Latina, I can relate to exactly what you're saying. It's taboo to talk about birth control and reproductive health. So I think it's important to find a physician that you feel comfortable with, of course. It's important to kind of go in having an idea as to what you may want to use as your birth control method, and then also kind of take any misconceptions that you've heard from your family or from social media and kind of dive into that and ask those important questions, because that will help you feel better about your decision. Ultimately, this is why I'm working with this great company called Organon. and we're working on having this program where we talk about birth control and how to approach that conversation with your physician, because it's definitely, these topics are definitely taboo, and we want everyone to feel comfortable with this conversation.
Absolutely. And, I do want to say that the younger generation and, the generations that are coming after us, they seem a little bit more comfortable with it. So, that's a plus side to all of this. But, for other women who are still, struggling with this, what are some birth control options that are out there that they should be aware of?
Yeah, thank you for asking that. So, of course, there's the short acting or more common options, which include the pill, the patch, the vaginal ring, and the injection. And then there's a category called LARC, or the long acting reversible contraceptive methods, which include the intrauterine device, or more commonly known as the IUD, and the implant. And then finally, there's a more permanent option called sterilization or tubal ligation.
Okay, and is there any, this is something that I'm sure that they will have to speak with their physician, but we can say that these are safe methods that they should consider nonetheless, right? It should the
Yeah,
conversation around.
sure. Yes. I think it's important for you to be honest about your reproductive history, your health history, and then based on that conversation or what you've used in the past, that will help guide kind of which method may be best for you.
Absolutely. And, as we wrap up and, for our Be Latina News audience, that they're very eager, they're very curious. What is your hope that, their final takeaways from this conversation is? Like, what do you hope that they truly understand from the topic that we're touching right now?
Yes. So, of course, number one, educate yourself. Make sure you really look and see what options are out there for you, because there may be some that you have no idea about, and that actually may be the best option for you. The second thing is, it's okay to ask questions that may seem different or something that you heard on social media. We want you to ask those questions, because that's what sometimes can make you not want to choose that particular birth control method. So please bring all your questions. And then finally, make sure you go to reliable websites or pages that actually can give you good information. And you can visit one that I'd like to share called www.whatsnextforher.com. Thank you.
Absolutely. And we'll definitely direct the audience to that website, because with so many things on the internet, it's so difficult to pinpoint which is an actual trustworthy website and which one actually has the best interest. And not only the best interest, but that are geared towards women of color, Latinas, and that they truly understand how our body works and, how we work culturally as well.
I agree.
So yes, thank you, Dr. Erica Montes. I really appreciate this conversation, and I'm sure it's going to help so many people out there.
Thank you so much, and thanks for the opportunity to be able to join you today.
Absolutely, Dr. Montes.